So today's topic for discussion is Gingiva. So you are familiar with the word Gingiva. So it has been covered in your first year. Okay. So Gingiva is a component of the periodontium. So the periodontium consists of four structures. One is gingiva, second one is periodontal ligament, third one is cementum, and fourth one is alveolar bone. So these four structures comprise your periodontium. So gingiva. So today we will discuss what are the macroscopic features of gingiva, then microscopic features of gingiva, the gingival epithelium, then how renewal of gingival epithelium takes place, then gingival connective tissue, gingival fibers, blood supply, and nerve supply. So, as you know, oral mucous membrane consists of three structures. One is masticatory mucosa, second one is specialized mucosa, and oral cavity lining the remainder of the oral cavity. So, mucous membrane lining the oral cavity. So, masticatory mucosa is composed of two structures. One is gingiva, and second one is your palate. So masticatory mucosa consists of gingiva and hard palate. Second one is your specialized mucosa. So specialized mucosa is usually occupied by your dorsum surface of your tongue, which is consists of specialized. They have specialized function for taste. So it is comes under specialized mucosa. And the third one is remainder oral mucous membrane covering the remainder of the oral cavity. So it may consist of buccal mucosa, then vestibular mucosa, alveolar mucosa. So oral mucous membrane is divided into three parts. One is masticatory mucosa, second one is specialized mucosa, and third one is mucous membrane lining the remainder of the oral cavity. So today we will discuss about gingiva. So what is the definition of gingiva? So gingiva is nothing but it is the part of the oral mucosa that covers the alveolar processes of the jaws and surrounds the neck of the tooth. So it is nothing but it is part of oral mucosa which covers the alveolar processes of the jaws, maxilla as well as mandible, and surrounds the neck of the teeth. So this is the definition given in Karanza. Then coming to what are the different macroscopic features of gingiva. As you can see, so the macroscopic features consist of three parts. One is marginal gingiva, second one is attached gingiva, and third one is interdental gingiva. So marginal gingiva, attached gingiva, and interdental gingiva usually constitute the macroscopic features of gingiva. So you can see clinically in the oral cavity these structures. One is marginal gingiva, second one is attached gingiva, and third one is your interdental gingiva. So in this figure you can see the marginal gingiva. So marginal gingiva is also called as unattached gingiva or free gingiva. So marginal gingiva is also termed as unattached gingiva or free gingiva. Second one is attached gingiva. So attached gingiva usually is firm and resilient. And third one is your interdental gingiva. So interdental gingiva usually occupies the your gingival embrasure species. So in this figure you can see the structure. One is gingiva. This is called as pre-gingiva or marginal gingiva. Second one is attached gingiva, and third one is interdental gingiva. So there is a groove that is present between your pre-gingiva and your attached gingiva. This is called as pre-marginal groove or pre-gingival groove. So this groove usually is a demarcation between your marginal gingiva and your attached gingiva. Then you can see here the mucogingival junction. So mucogingival junction, it is present between your alveolar mucosa and your attached gingiva. So it is a demarcation between your attached gingiva and your alveolar mucosa. This is gingival sulcus. So gingival sulcus is a V-shaped uh, space. It is present between your tooth and your gingiva. So this is, so coming to marginal gingiva, as you know, marginal gingiva is also called as terminal free gingiva or unattached gingiva. It is called unattached because it is not firmly attached to your tooth structure. It is free. So marginal gingiva, it is the terminal edge or border of the gingiva surrounding the tooth in a collar-like fashion. Usually, the marginal gingiva is terminal edge of gingiva and it surrounds the tooth in a collar-like fashion. So you can see in this figure. So this is your marginal gingiva. So it is usually not attached firmly to your tooth. So that's why it is called as unattached gingiva. And this is the terminal border or edge of your marginal gingiva. So, and this marginal gingiva usually surrounds the whole tooth in a collar-like fashion. So, this marginal gingiva is demarcated or it is free from your attached gingiva by a marginal groove. It is called as free gingival groove. Usually, marginal gingiva is 1 millimeter wide and it is present 1.5 to 2 millimeter coronal to your cemento enamel junction. As you can see in this figure, this is the marginal gingiva and below this is the alveolar bone and cemento enamel junction. So, it is present about 1.5 to millimeter coronal to the cemento enamel junction. So this is marginal gingiva. Now coming to gingival sulcus. So gingival sulcus is nothing but it is a shallow crevice or space present between your tooth surface bounded by one side and your gingival epithelium lining on the other side. So usually it is a V-shaped type of space that is present between your surface of your tooth and the epithelial lining of your free gingival margin of your gingiva. So usually gingival sulcus is present, it is about 2 to 3 millimeter in depth. So various authors have studied the histological depth of your gingival sulcus is 1.58 millimeters. When you are studying under your histocare histologically, usually the depth of your gingival sulcus is 1.5 or 1.8 millimeter. But clinically, when you are probing with the help of a periodontal probe, usually the gingival sulcus normal depth is usually 2 to 3 millimeters. So you can see ideally, normally or ideal condition, the depth of gingival sulcus is 0. But this condition usually you can't find with the depth gingival sulcus with the depth of 0. Then histologically, it is 1.8 millimeters, 1.5 millimeters according to cyto. So probing depth. So this is important parameter while recording your case history. So the probing depth of gingival sulcus is 2 to 3 millimeters. Now coming to second part is attached gingiva. So this attached gingiva is most important part of gingiva. So whenever you are taking case history, recording case history, you should determine the attached gingiva. So attached gingiva is firm, resilient, and it is tightly bound to the underlying periosteum of alveolar bone. So attached gingiva usually is firmly bound to your underlying periosteum of your alveolar bone. So this part is immovable. So it is firm and it is boundly resilient and bound to the underlying periosteum. So you can see this is the mucogingival junction. So mucogingival junction is the demarcation between your alveolar mucosa and your attached gingiva. So usually attached gingiva we can see stippling, that is oral pinch appearance. In this figure we can see the dots we are seeing. This is called as, there are some depressions and elevations. So this is called as stippling. This stippling appears like your orange peel. Okay? And usually the stippling is present on absent on your palatal side. Usually it is seen on the buccal surfaces of your gingiva, whereas it is absent on your palatal as well as your lingual gingiva. So now coming to the width of attached gingiva, there are two terms. One is width of keratinized gingiva and second one is width of attached gingiva. So width of attached gingiva is nothing but it is the distance between your mucogingival junction and the projection on the external surface of your gingival sulcus. Whatever external projection is seen, so this distance between the mucogingival junction and projection on the external surface of the bottom of sulcus is called as width of attached gingiva. So when you are recording case history, we have to determine the width of attached gingiva. So how it is calculated? It is distance between your mucogingival junction minus your probing pocket depth or gingival sulcus. So this is called as width of attached gingiva. Another term is width of keratinized gingiva. So in this keratinized gingiva, it includes attached gingiva plus the distance between your attached gingiva to your free marginal groove. So this is called as width of keratinized gingiva. So now coming to width of attached gingiva, various authors have determined the width of attached gingiva. So the width of attached gingiva in maxilla in anterior regions it is 3.5 to 4.5 millimeters, whereas in mandibular areas in anterior, that is lateral incisors and central incisors and lateral incisors, it is 3.3 to 3.9 millimeter. It is highest in anterior regions, whereas it is lowest in first premolar area. That is, whenever it is considered in maxilla, it is 1.9 millimeter in first premolar areas and 1.8 millimeter in your mandibular region. So, width of attached gingiva is highest in incisor anteriors incisors and it is lowest in your first premolar areas. So highest is in maxilla it is 3.5 to 4.5 millimeter and in mandible it is 3.3 to 3.9 millimeters, whereas it is lowest in maxilla in first premolar region it is 1.9 millimeter and in mandible it is 1.8 millimeters. So as we can see the so width of attached gingiva, the width of attached gingiva increases as with increasing age. So various authors have studied the width of attached gingiva. So attached gingiva, how to calculate width of attached gingiva. So width of attached gingiva is calculated width of keratinized gingiva minus your sulcus depth. So this is how we calculate your width of attached gingiva. So there are some tests to determine the width of attached gingiva. One is the total width of gingiva, that is keratinized gingiva minus your sulcus depth is termed as width of attached gingiva. Another test is roll test. We roll the blunt end of instrument of any probe from alveolar mucosa towards coronally towards your pre-gingival margin. So this will determine the width of attached gingiva. Also, there is one solution, that is Schiller's iodine solution, which stains your alveolar mucosa. So with the application of this Schiller's iodine solution, the alveolar mucosa gets stained and it is demarcated from attached gingiva, so that we can determine the width of attached gingiva. So these are various tests to determine the width of attached gingiva. So what is the importance of attached gingiva? So whenever there is inadequate attached depth, so there is narrow zone of gingiva is considered insufficient. So to protect the periodontium from masticatory forces, whenever there is inadequate width of attached gingiva, it doesn't protect the periodontium from masticatory forces, dissipate the pull because of muscles of adjacent mucosa. Then inadequate zone of gingiva favors subgingival plaque accumulation. Whenever there is inadequate width of attached gingiva, there is more amount of subgingival plaque accumulation. There is continuous attachment loss. The soft tissue recession usually takes place whenever there is insufficient width of attached gingiva. Then there is Along with decreased vestibular depth, it causes accumulation of food particles during mastication and impedes oral hygiene measures. Whenever there is inadequate width of attached gingiva, there is inadequate vestibular depth. So there is difficulty in placing your toothbrush while you are toothbrushing. So whenever there is inadequate oral hygiene procedure, that will lead to your more accumulation of your subgingival plaque. So various authors have studied the attached gingiva. So according to Bowers, it is considered the gingiva should be maintained with less than 1 millimeter present. So whenever you are having greater width of attached gingiva greater than 2 millimeter, it is considered to be a adequate width of attached gingiva. So now coming to second is interdental gingiva. So interdental gingiva is nothing but it occupies your gingival embrasures, which is the space present between your area of tooth contact. So here this is called as your gingival embrasure. So interdental gingiva usually occupies this gingival embrasure space. So it is present beneath your contact point. So it is determined between contact relationship between the teeth, then width of your proximal tooth surface and course of your CEJ. So interdental gingiva usually in anterior region it is usually pyramidal in shape, whereas in posterior it is somewhat flatter. As you can see in this diagram, so as you can see in this diagram, so whenever uh, in interdental gingiva in anterior region, it is usually pyramidal in shape. This pyramid is formed by gingiva of your buccal and palatal or lingual gingiva. Then whenever interdental gingiva is seen in posterior regions, it is somewhat flat and the shape of interdental gingiva is usually cone shaped. So this is the diagram showing the in posterior region the diagrammatic representation of your cone. So this is your buccal papilla and this is your lingual papilla. So these two elevations and there is one depression below the contact point. This is called as your cone. So interdental gingiva usually it is pyramidal in anterior regions and flatter in mostly in your posterior regions. So this is the structure that is contact point. So contact point usually determines the uh, width of your interdental gingiva. So now coming to macroscopic features of gingiva. So usually the gingiva is classified into two parts. One is epithelium and second one is your connective tissue. So macroscopically it is classified into gingival epithelium and gingival connective tissue. So now coming first, we will discuss about the gingival epithelium. As you know, gingival epithelium, the main principal cell of gingiva is keratinocytes. So keratinocytes are considered as the principal cell of your gingival epithelium. So what are the functions of gingival epithelium? So it protects the deeper structures. That is, whatever structures are present, for example, alveolar bone. Uh, so these structures usually are protected by your gingival epithelium and it also protects your gingival connective tissue. Then it is helpful in your mechanical, chemical, and microbial barrier. So gingival epithelium also acts as a barrier to your mechanical and chemical. Also, it acts as a signaling function. So whatever signals are present, these are transferred to your. So gingival epithelium is broadly classified. There are three types of epithelium. One is oral or outer epithelium, second one is circular epithelium, and the third one is gingival epithelium. So in this figure we can see the three structures of gingiva, that is this is called as oral epithelium. Whatever epithelium is present in your oral cavity, this is called as oral epithelium, also called as outer epithelium. Second one is your circular epithelium. So circular epithelium usually lines your gingival sulcus. And third one is your junctional epithelium. So junctional epithelium is the third epithelium of gingiva that usually attaches the gingiva firmly to your tooth surface. So this epithelium, so junctional, usually the epithelium that is present in gingiva is squamous stratified epithelium. So whenever the squamous stratified epithelium is present, then there are four cell layers of your structure. One is stratum basale. So this layer is called as stratum basale. Second layer is stratum spinosum. Third layer is stratum granulosum, and the fourth layer is stratum corneum. As we go uh, from connective tissue to your outer epithelium. So gingival epithelium is made up of four layers. One is stratum basale, also called as basal layer. Stratum spinosum, also called as prickle cell layer. Third one is stratum granulosum, also called as stratum granulosum, also called as granular layer, and stratum corneum, also called as cornified layer. So every gingival epithelium usually consists of these four cell layers. So the principal cell type of gingival epithelium is comprised of keratinocytes. So keratinocytes are considered as the main principal cells of your gingival epithelium. Also, in addition to this, you can find non-keratinocytes. These non-keratinocytes are also called as clear cells. So non-keratinocytes are Langerhans cells, Merkel cells, melanocytes, and there are some inflammatory cells. These four structures, that is Langerhans cells, Merkel cells, melanocytes, and inflammatory cells, these are called as non-keratinocytes or clear cells. So these structures usually are present in your gingival epithelium. So what is the main function of your principal cell, that is keratinocytes? So the main function is proliferation and second function is differentiation. So proliferation is nothing but each cell is divided into two daughter cells, that is mitosis occurs as the cell proliferates from basal layer to your superficial layer. So one is proliferation. Each cell is divided into two daughter cells. So this process is called as mitosis. Second one is differentiation. So differentiation is nothing but this is a histochemical process or chemical process. Usually there is flattening of nucleus as the cell migrates from basal layer to superficial layer. Second one is the size of the nucleus disappears. In basal layer, usually the nucleus we see presence of nucleus, but as we go from basal layer to superficial layer, there is disappearance of nucleus. So these are histochemical processes that takes place. So morphological changes that takes place during differentiation are there is progressive flattening of cells with an increasing prevalence of chlorofilaments. So as the cell migrates from basal layer to superficial layer, there is progressive flattening. As we can see here at the basal layer, these cells are somewhat cuboidal, but as the cell goes from basal layer to superficial layer, that is super corneum layer, the cell gets flattened. Second morphologic changes is intercellular junctions coupled to the production of keratohyaline granules. So in basal layer, the presence of granules are usually less, but at the cell migrates from basal layer to superficial layer, there are presence of keratohyaline granules. Then there is disappearance of nucleus. We can see the nucleus in basal layer, whereas in superficial layer there is absence of nucleus. Okay, now coming to main four cell layers of basal gingival epithelium. So first is stratum basale. You can see in this figure the cells usually are cuboidal or cylindrical in shape. They contact with the basement membrane of your gingival connective tissue. So mitotic division, cell division occurs. That is, each cell is divided into two daughter cells, as you can see. So this cell, so this basal layer usually consists of your basal lamina and it joins the epithelium of the underlying connective tissue. So this usually stains with fast positive. Second stage is stratum spinosome. So spinosome is 10 to 20 layers in. So here the cells are usually large or polyhedral in shape. There are short cytoplasmic processes resembling the spines. This layer usually occurs have a prickly appearance. So this is called as prickle cell layer. So here desmosomes located between cytoplasmic of adjacent to their cohesion. Third layer is stratum granulosum. In this stratum granulosum, we can see keratohyaline granules. So, as we have discussed, there is presence of keratohyaline granule as we uh, from super basal layer to your as the cell migrates from your basal layer to your superficial layer. Very sudden keratinization of the cytoplasm of keratinocytes and converts into your horny squamate. And the last layer is called as stratum corneum or corneal layer. So it is filled with corneum. Here the nucleus is disappeared and the complete keratinization occurs in the process. The complete keratinization may be orthokeratinized, parakeratinized or non-keratinized. So stratum corneum usually consists of orthokeratinized, parakeratinized or keratinized epithelium. So what do you understand by the term orthokeratinized, parakeratinized, orthokeratinized and parakeratinized and non-keratinized? So orthokeratinized, this is the superficial horny layer. You can see there is no nucleum in the uh, fourth layer, that is stratum corneum, and well defined stratum granulum. Keratohyaline granules are usually well defined in orthokeratinized type of gingival epithelium. Second is parakeratinized. So here in this parakeratinized we can see a pycnotic nuclei. So this is the pycnotic nuclei. Then there is dispersed keratohyaline granules and there is absence of stratum granulosome. Whenever stratum granulosome is absent, then it is called as parakeratinized. Whereas in orthokeratinized, there is appearance of keratohyaline granules. Then those epithelium is called as orthokeratinized. Whereas in case of parakeratinized, we can't see the stratum granulosome. That is, third layer is usually absent in stratum. And next layer is non-keratinized. There is viable nuclei. We can see the nucleus and there is absence of stratum granulosum and corneum in case of non-keratinized type of gingival epithelium. Now coming to, so up till now we have discussed the principal cells of gingival epithelium, that is keratinocytes, and the process, that is proliferation and keratinization. Now coming to the another cells of gingival epithelium, that is non-keratinocytes. So non-keratinocytes are of four types. One is melanocytes, second one is Langerhans cells, third one is Merkel cells, and fourth one is inflammatory cells. Now coming to melanocytes. So melanocytes, these are nothing but your dendritic cells. Usually melanocytes are present in your basal layer and your spinous layer. So melanocytes usually are present in large amount in basal layer and your second layer, that is spinous layer. So pre-melanosomes or melanosomes. So these are the principal cells which consist of your melanin. So whatever gingival pigmentation we see in gingiva is mainly due to these melanocytes. So how pigmentation occurs? So tyrosine is usually converted into dihydroxyphenyl allele, that is dopamine, and this later on converts into melanin. So this melanin is usually responsible for formation of your gingival pigmentation. So melanin usually occurs in your gingival epithelium, and this is usually produced by your melanocytes. There also term, that is melanophores. So these are the cells or phages which phagocytes your melanin. Second is Langerhans cells. So Langerhans cells usually these are considered as your dendritic cells. So these Langerhans cells are present mostly in your suprabasal layer, that is spinous layer. These are modified monocytes, and they usually compromise your uh, immune reactions. That is, and these are considered as your antigen presenting cells. So there is one in Langerhans cells usually consist of these specific granules. These granules are called as Birbeck's granules. So these Birbeck's granules usually are present in Langerhans cells. So these Langerhans cells are present in oral epithelium and your circular epithelium, whereas they are absent in your junctional epithelium. Third one is Merkel cells. So these Merkel cells usually are present in deeper cells. They usually harbor your nerve endings, and they are mainly responsible for your tactile receptors. So tactile perception is usually uh, found the function of your Merkel cells. And the last one is inflammatory cells. Various inflammatory cells are present in your gingival epithelium. So lymphocytes, usually T lymphocytes and B lymphocytes are present in your junctional